Yeah, hi, this is Damen Campbell from HGH Vallarta Clinic. I'm here today with my son, Diego Campbell, and Leon Fitzpatrick, the HGH Vallarta team. Welcome.
It's good to be here. It's good to be here.
Yeah, so Diego's 16, Leon's 27. Today we're going to go through a few things. We're going to talk about like the parameters of the blood work that we need, and we're going to kind of go through our personal blood work to see what is actually going on. So what are the symptoms of when you have low IGF-1, which is the growth hormone level? Decreased energy, increased fat, decrease in lean muscle mass, difficulty exercising, osteoporosis could be a long-term side effect, sleep disturbance, skin changes, fine lines, dryness, thinning, so your skin you notice things in your skin. Basically aging quicker. Psychological symptoms such as depressions and feeling of social isolation, poor short-term memory, difficulty concentrating. Signs of low testosterone. You got decreased libido, your muscle atrophy, where your muscles are kind of deteriorating. Osteoporosis again, erectile dysfunction, fatigue, depression, infertility, weight gain, hair loss, etc. So the idea is trying to take these things can help alleviate a lot of those symptoms. So today we're kind of going to go through blood work of Leon, who's 27, Diego, 16, and I'm 50. So we're going to go through it. Obviously, I take HGH and testosterone. These guys don't take anything. And you're going to see the differences in the blood work and what have you. Let's start with you, Diego.
I'll just quickly add that whenever somebody gets their blood work done, usually the ranges that are like the median for your age are displayed right next to the actual value.
So what is your total testosterone?
My test is at 614.
And what's the range?
What is it, 31 to 733?
So you're basically like in the top, like you're above 80, the high end of your range.
And IGF-1 is 307.1.
So you naturally, at 16, or those were done when you were 15,
yeah,
you're over 300 with your IGF-1.
Yeah.
Yeah, and those are great levels. And this is the reason why is because that your levels are so high is because you're still growing. And what's the range on the IGF-1?
102 to 520.
So you're kind of like mid-range, and but you're still growing. But your growth rates are probably pretty close to closed.
Yeah.
But you still have the potential to grow.
Full natty.
And how do you feel? I mean, obviously, how does anybody feel at 16? But how do you feel at 16?
Working out, going for runs, eating a lot of steak and chicken.
Right. And so you're working out, and sometimes you work out twice a day.
Yeah, exactly.
And then you also will play basketball.
Yeah.
And then you'll work out. And so you're just extremely active, and you have high energy. And you just got off the phone with Starkey, who was a Green Beret, and you're thinking about going into like special forces or seeing what entails in that path. So you're just jacked up on life and what you got going looking forward to in your future.
It's upcoming, all right? I'm up next. Just be ready.
Yeah, exactly.
Right.
We're ready. We're ready for you, baby.
Let's go.
Bring it. Now, so Leon, what?
And so for me, my IGF-1 is at 239.4, and it's right here, nanograms per milliliter, it says here.
What's the range?
And my range is 94 to 271, so I was doing pretty good.
You're basically in the upper end of your range, too. You're right there.
In my case, I wouldn't really look into taking HGH at all because it's not necessary. I don't really have a deficiency. If I were really into the body, I work out. I go to the gym 5 days a week. But if I were to compete or do something like that and trying to give myself that edge, then maybe I would look into.
Well, the thing is this: you're 27, right? So you feel good.
Yeah, I don't need it.
Like you feel good. Mm-hmm. Like you mentally you feel good.
Now, if I was 35 and my range and my IGF-1 was 100, 120, then HGH would definitely sound like a good idea.
Well, the thing is, when you're talking about men, you're talking about their physical peak is between, 27, 29 years old. So you're at 27, so you're just kind of at the beginning of your physical peak. The best physical condition you're going to be in your life. And so, if you feel fine, there's no reason to mess with it. The thing is 10 years before, fast forward 13 years when you're 40, then it's certainly, then you think about it. Yeah. But at 27, you don't need to do it unless you were, I don't know. Well, unless you want to, it's like not that you can't, but the thing is, you just need to monitor it and whatever. So, your testosterone was what?
My testosterone level here was 566 nanograms per deciliter, and the range here says 120 to 1,019 nanograms per deciliter. So there are two as well. I mean, it's fine. There's
That's a fine level.
Slightly over the middle of the range there. Well, I mean,
you're in the middle.
566 is fine. It's good.
It's fine. It's healthy. It's a good number. It's absolutely fine. Now we're going to go to mine. This is where I'm going to take my shirt off. No, he's like, no, God. No, God. Here it comes. He's starting to get uncomfortable. Okay. Okay, here we go. So anyway, get drum roll. No, I'm kidding. So my IGF-1 is 280. The range for me is 68 to 225. So I'm like 35 units out of the top end of my range.
That's pretty good.
That's fine. Yeah, but I'm taking HGH. So I do about 2 IUs a day, 5 to 6 days a week, and so about an hour before I go to bed. And this is what it helps with recovery. And so this is the thing, and it helps with my energy, every single day. I also stopped drinking about a month ago. Actually, more than a month ago, and actually that was a big thing.
Better.
I feel much better. Yeah. Okay, so that's my IGF-1. So it's 280. And then if we're going to go into, now this is a little bit on the higher side, but my testosterone is 1290. And it ranges 120 to 1019. So it's 120 to 1019, and I'm at 1290. It's a little bit high, but so what that has, I take a product called Libido, and I take it about once I take it every 4 to 6 weeks. And so what this is probably, I was doing here is probably doing it every 30 days. And so what happens is your level will go up. And so to bring it back down, I just got to wait a little bit more before my next injection, and the levels will come back in line and get into the top end of my range and not outside of the range. But regardless, I feel good. It's important to get your blood work done. These are just the numbers, and this is how you measure the results of what you're taking, whether it be HGH or testosterone. But what you want to check is you want to do your tumor markers to make sure that you don't have any cancer. They're going to check your cholesterol, check your your red cell blood count. For men, they definitely want to check your PSA, which is your prostate, and how is that doing? And that's the PSA blood test, and that needs to be in the range. A few years back, we did have one client who came in. He was a little bit on the high side of the range when he started. Actually, he was a little bit outside of the range when he started. The doctor said, okay, but we got to keep an eye on it. You need to get your blood work done in 3 months. The guy was great because he did. Unfortunately, when he came back, his level was at like 8, which was it was like double where he was before. And the doctor said, stop everything. And his level wound up going to 16, and he wound up having prostate cancer. Anyway, the gentleman's fine. But this is why it's important, because testosterone can be like gasoline with your prostate, and it can make it worse.
Yeah, you're
and
pouring
you
gasoline
don't
on
want
fire.
it. Yeah, so it's very important that you do that. For women, they test the CA-125, which is actually to see if you have any type of issue, ovarian stuff with that. Yeah, and there's other blood tests that we do.
There's the liver profile. You always want to. Your doctor usually wants to look at how the liver's doing before considering something like HGH treatment, right? You also want to check your glucose levels. Also, the doctor's usually interested in that. Your TSH, your thyroid stimulating hormone.
Right.
Also, he also asks for that.
Right.
So, usually what I tell people is that, a full blood panel is good once a year. And then 6 months after, if you're taking anything, you want to check your hormone. Just do kind of like a hormone panel. If you don't want to do the full panel twice a year.
Well, we're not doing a full hormone. We're not doing a full workup. I mean, this is specific things just to make sure that you qualify for taking HGH. It's kind of like the basics of what's needed to clear patients.
Yeah, with what the doctor asks for. If you don't want to do the full list, just usually like 6 months after the hormone panel is good, just to monitor how much your testosterone and your IGF-1, if you're taking both, have increased, and if you need to make adjustments on your dosage, which you need to consider a couple of things. You need to consider how you're feeling, how much said hormone has increased.
So those are the basics. I mean, you took testosterone one time, but you didn't stay with it. You didn't feel like it was something.
Just kind of like for 6 weeks, I took something that's called Testosterone 250. I felt my endurance go up a little bit. My strength in the gym really didn't increase that much. Yeah, after a while, I was like, well, you know what? I just kind of
you don't need to do it. You don't need to mess with it. At this point. It's fine. What our blood test came back is, you got a 27-year-old, 16-year-old, and a 50-year-old, and this is what's going on. These guys are natural. I'm taking the stuff, and here we are.
Yeah, just to clarify, when I took these tests, I was natural. So after these tests, I decided to go for like just 6 weeks of 1 milliliter per week of testosterone, and I didn't really feel much of a difference because I didn't really kind of give it a chance to really like increase the testosterone there.
Mm-hmm. Yeah, the biggest impact I've ever had in my life was taking HGH.
Mood improvement, recovery. I mean, really the main thing for people is recovery, right?
If I'm going to talk about getting fired up on this show, I'm talking about taking HGH.
I love the character.
You know what I mean?
Yeah, te metiste en el papel.
I took HGH, and I felt great doing it.
I felt it.
Yeah.
I felt that.
No, really, HGH is... I think it's better than testosterone, if you ask me. You want my personal opinion about what you want to take? You want to start with HGH. And 3 months later, what you want to do is you want to try testosterone.
Top priorities. Your 2 life priorities, right there.
If there's one thing you're going to do in this life is take HGH. The other one is buy it from us. So here at HGH Vallarta, we're here for the people.
That's right. That couldn't have been said better, to be honest with you, because that's exactly what we're here for.
Abraham Lincoln would be proud.
Yeah.
We're here for the people.
I mean, we were doing reaction videos last week, and these guys are talking about, fasting, boosting your IGF-1 level, your HGH levels 1,600%. And, eating certain types of food is going to boost your HGH levels 19-fold. These guys are so full of shit, and they're so lying in front of everybody on camera, and there's no consequences for it because it doesn't work. The only way that you're going to boost your level up is you need to actually take it, and it needs to be through a subcutaneous injection. It can't be taken in a full pill form because it gets digested in the stomach, and it doesn't work. The only way it's going to work is it needs to be injected 5 to 6 days a week or daily, and that's how you're going to bump your levels up. Anything else is not going to, it doesn't do the trick. These guys are going to tell you can, Semarilin, you take that, it'll stimulate the pituitary gland into producing more HGH, but the amount that stuff does work is so minimal that you're not going to see any real significant improvements in your health or the gains. You're talking about, if say you're at 150, your IGF-1, this is going to bring you to 160, when really you need to be at 250. It's not going to get you there. So those products don't work. The only thing that does work is knowing that you're getting pharmaceutical grade from Pfizer, from Merck, from Lilly, from Novo Nordisk, from Sandoz, these big pharma brands. That's the only way you're going to know for sure that you're getting the right product, and those need to be injected. So that's the only proven way it works. And yeah, it does work. It will help with your mood. It will help with muscle gains. It will help with your recovery time. It does help children grow taller. It works.
There's no question about that. Yeah. Now, Damien, would you say it's accurate when someone asks, the difference between taking testosterone and HGH is that taking HGH does not affect the natural production of the hormone in your body?
For what I understand, taking HGH is not going to affect the normal production in your body. I mean, the issue is that most people are really on the lower end of they're on the lower end of their range. I mean, people were talking about, say the range is for a 49-year-old is 60 to 225, which is what it was here. A lot of people are like 120. So it's not terrible. But listen, if you're up to 225, 250, it's a totally different experience in life than it is if you're at 120. It doesn't shut you. Like if I was to stop taking HGH today, my levels would go back to where they were, which would probably be around the 180 mark is what it was when I started. But that was 9 years ago. So I don't really know. I mean, but the issue with, and my testosterone would drop down to where it was, years ago, it was probably around 450 is what it was. I want to be at the upper end of my range. I'll be like, I feel a little bit off. Oh, it's like, oh yeah, I need to take my testosterone shot. It's just what it is. So you take it and it's like, okay, you're back, boom. The next day you're back, you're like fired up and you're ready to go. So that's what it is. Like Dorian Yates, once the glass is full, it's full. And so you have a glass and you pour water in it. And once the water starts overflowing, that's it. It's like you can't fit any more in that glass. It's just kind of the same thing with taking testosterone. It's like once it's full, it's full. These guys, I mean, and full is really, it's for these guys is not the top end of your range. It's higher than that. But some of these guys are like 4,000 on their testosterone. I mean, you're taking one of those, 1 in 250 a week, one injection a week, and these guys are taking 5. And he was like, and then they're stacking it with other stuff. So it's a different thing. But but to your point, he has to take it. He has to take it for the rest of his life. But he wants to take it because he wants to feel good. He likes working out. A lot of these guys, like I mentioned, we ran into a guy in the gym the other day, and he was just kind of, he's been going there for years. I've seen him for years, and he hasn't gotten any results. I went up to him the other day. I was like, hey, man, are you taking anything? I'm not trying to push anything on anybody. I was like, are you taking anything? I mean, it'd be a good idea. I mean, I was just saying, he's like, no, I'm afraid of it. I'm like, okay, that's fine. I mean, I was just asking. I go, it would help with your energy. It'll help you get results. He goes, well, you're just scared of it, and blah, blah, blah. I'm like, okay, maybe I'm going to push it. But I was just like, because you see people and they look kind of like there's something, like they look old and skinny and they're like no energy, like in their face. They got like, they're walking around and it's like, it's just an expression. And it's like, well, I don't know. Fuck, it's obvious that you're not, something's
help.
off. You're not feeling, you're here, but you're not really fired up and you're not really feeling well. You're not like really happy to be here. And so this is the thing. It's like when you see guys in a gym and they're older and they're fired up and they're in a good mood and they got good energy and you're like, what? They're taking something. They're not just drinking protein powder and eating fucking
creatine.
Steaks. I mean, but this you can eat steaks. I mean, obviously you need to do that, but I mean, they're not. But they're doing something and they're figuring it out. Because the whole point is you're trying to figure out how to feel better every day, and it's constant work. It's not just going to happen on its own. Like you can't just sit home and eat
Oreos all day.
Oreo cookies and do nothing. It's like if you want to do something, well, go do it.
Oreo cookies and whiskey.
Yeah, and fucking whiskey. Yeah, why not, man? Smoking some of that herb.
Yeah.
Right.
Yeah.
Dago, well, now what do you know about smoking weed, dude?
Tell us. Tell us what's your experience with it.
Yeah.
Have you gone to El Punto?
No. No. Forget it. No, yeah, I'm just joking. For the record, he's never smoked weed. He's on a path to be Green Beret. This can't come out. This came out. Okay, so I think the big thing is with the testosterone, what you hear is these guys, the bodybuilders take it out of the range so far for so long that their natural production of testosterone shuts down, and it doesn't. For a lot of these guys, it doesn't ever really come back, not even close to where it was or where it should be naturally. And the other thing, you compound that with age, because as you're fighting the clock, because the older you get, the less you produce. And this is kind of the example we were going through with the age difference thing between Diego and you. I mean, his was higher.
Yeah.
Well, his is ridiculously high. I mean, we've never had a client come in, maybe one out of 1,000 clients that's come in and had a level that high and that was over 45. It doesn't work. It doesn't work. Because what happens is the older you get, it's like an inverse relationship. The lower your testosterone goes. And so the only way to supplement that is you need to take it. Now, You know, you can fasting. All this stuff helps. You need to have a healthy lifestyle. But the way to do it is you need to take it, and you want to feel better. I mean, look at Joe Rogan, look at Dana White, look at Sylvester Stallone. I mean, the list, you go down the list. These guys you have to take it, and it is what it is. You want to feel good, you want to have energy, you want to be running businesses, you want to be exercising, you want to be riding your bike, playing golf, playing with your kids, enjoying the money you make, enjoying your life to the fullest. You need to do something. You know, you don't want to have deficiencies in testosterone, deficiencies in growth hormone, because guess what? You're going to be dragging ass.
True.
It's true.
Yeah, true.
It's true. I mean, at 16, you don't even know. But the point is, it's like, which is the beauty of being 16. Everybody, like, if I was 50, I want to have the energy of a 16-year-old. I mean, I'm not quite going to get it. I know that. But at least I want to be
close,
doing what I can to get there, you know? I mean, like, feeling like I can still somehow compete with you, but I'm not going to go to gym twice a day at 50. But I did when I was 16. The energy you have right now in your life is the highest it's ever going to be. 16, 17, 18. I mean, you still got a lot of years left of that. So, but you're there.
Getting off the couch won't become easier, huh?
Yeah, for sure.
So,
yeah, you're not on it. You fucked, dude. You're not even close to the couch.
Yeah,
Right? Well, you're on it now.